Welcome back to my YouTube video channel. Today I will explain to you how as a dental assistant, if a new dental assistant, you got a job in a dental office and you try to figure out how to remember the tooth number. When your dentist say, take an x-ray number 8 for me, and you get confused, you don't know what to do. So I'm here to teach you how to remember the tooth number in the person mouth. As you can see inside a patient mouth, this is when the patient open their mouth. The first one right here is tooth number 1, which is not in this model. It's called upper right wisdom tooth. So number 1, number 2, number 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16 is not present, but that's called the wisdom tooth on the upper left. This is a wisdom tooth on the upper right. And if you look at the model down here, again, wisdom tooth on the lower left, wisdom tooth on the lower right, they're not present because this model they don't show that. But if you look at the patient mouth, the wisdom tooth could be underneath the bone here because it's not erupted, or it may be removed. So again, this is 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32. Okay, so again, this is 32 not present, 17 is not present. If you look at the anatomy real quick here, that's the canine. So this is 22, lower left, 22. 27 is also lower right canine. So those key tooth that you need to know, this is the canine, this is called upper right canine, or it's called number 6, and then this is the canine here is number 11, upper left canine. So you must remember that key number, tooth number. The other thing I want to teach you is any tooth from here to here is called posterior tooth, mean like tooth behind. Okay, in dentistry we call tooth posterior tooth, premolar, and molar. So anything like that's called posterior teeth. And start from the canine to canine, we call anterior teeth. So that's what we call front tooth or anterior teeth. So for the dental assistant, because the dentist is going to go like, okay, can you take an x-ray on canine upper right side? You need to know it's right here. And you take an x-ray on the canine upper left. This is the canine I'm talking about. But sometimes he doesn't say that. He just said tooth number 6. So you got to know this is tooth number 6. So the canine, that's the tooth we're talking about. Sometimes your dentist don't say, you know, if he's 9, he could say upper right side is easy, but he might say tooth number 3. So you got to know this is number 3. So 1, 2, 3. Okay, so third molar, second molar, and the first molar. And this is second premolar, first premolar. So when he or she can say, take an x-ray on the upper right first premolar. He's talking about this one. Or he can say, take an x-ray on first premolar, tooth number 5. This is what he's talking about. So you have to know the couple different way of when we communicate with you guys. Either this is called first premolar of the upper right side, or we just say the number 5. This is number 4, second premolar. First premolar, first molar, second molar, and third molar. That's the upper right side section. So when we get to here, this is called the lateral incisor, and this is called the central incisor. And this is called not a central incisor. No. So this is number 8. This is so 6, 7, 8, 9, 10, 11. Okay, and then 12, 13, 14, 15, 16. So this is again, this is lateral incisor, central incisor on the upper left side. Canine, first premolar, second premolar, first molar, second molar, and third molar. So again, every quadrant of the patient mouth only have a third molar, which is a wisdom tooth. Second molar is right here, and the third molar is toward the front. So just remember that. We sometimes in dentistry we go backward a little bit, but you gotta understand that number 17 is not present here. So it's number 18 right here, 19 right here. Again, keep going. It's 20, 21, 22 is the canine that you should know. on each corner. You have to identify which one is the canine, which one is the premolar and lateral incisor here, central incisor. These are called 23 lateral incisor on lower left, 24 central incisor on lower left, central incisor on lower right, lateral incisor on lower right, and this is lower right side canine, or number 27, 28, 29, 30, 31, and wisdom tooth is not present. Now, I want you to learn something else really quick. In the upper arch, that you can see how beautiful God create the anatomy of the molar. He create nicely for you guys to chew, for us to chew, and for front teeth is to eat, to bite food, right? So you eat an apple, you usually use this. But when you cut the apple in smaller size, and you don't need to bite anymore, right? So you're gonna chew. So you're gonna use these cuts right here. This is called a functional cuts. Functional cuts, you guys. You have to know, if not you're supposed to know that. This is called non-functional cuts. We don't say that in the anterior teeth because we don't use them to chew, but we use them to bite only. Same thing on the bottom tooth. It's opposite. On the bottom tooth, the molar, anything right here on the buccal side, this is called buccal cusp, or we can also call functional cusp. Okay, this is where when your food coming down, usually it's contact between the functional cusp of the upper, and also it come down to the fossa, central fossa of the molar and premolar here, but it's gonna hit the functional cusp of the molar here. So when you are making at an RDA or dental assistant, you make a temporary crown for a patient, you need to reduce the functional cusp down, because it's a temporary crown. If you make it so high, when the patient chew, they're gonna break the temporary crown for a patient, and you have to redo several times when they come back and before you deliver a permanent crown. Understanding the concept of functional cusp is very important. And so again, I just want to teach you a little bit about the dental anatomy of a patient. If you have any question, feel free to ask me again. I'm hoping you have a small lesson to learn. This lesson will help you to reinforce your knowledge, because even you take the class in the dental RDA class, you might not remember. This video can help you to review it for you. I hope you have some foundation, some reinforced training. Just review real quick. If you want to learn really quick how to remember, the trick is upper right side, start right here, is 1. Right here is number 8. Number 9, number 16 right here. So if you remember the key tooth number, you can quickly identify the rest of the things. So 1, 2, 3, 4, 5, 6, 7, 8, right? So if you know this is 1, 2, 3, 1, this is number 8, number 9, number 16, you can get it. So 17 right here, go right in the middle here is 24, 25, and then 27 here, and then 32 right here. Sorry to confuse you, this is 32 right in here, but it's not present. So in front of the 32 is 31, in front of 31 is 30, in front of number 30 is 29, in front of 29 is 28. This is a kind of review for you to learn. So if you don't review, remember this is the number 19, you know this is 18, and this is, so 19 right here in front of it. You have to count this, start from counting from here. So 17, 18, 19, 20. That's how you count all the way up here. And on the upper, you count from upper right side all the way to this side. Okay, have a great day. Bye-bye.